Okay. Depends. There's a sign-in sheet. We'd love everyone to sign in. Tate, you could walk that around if you could. Thank you. You need Morphus? Thank you for coming out for our vigil and public education session here. This is one of nearly 300 we can't afford to wait vigils around the country happening right now. Tens of thousands of Americans are taking action today because we're at an incredibly crucial moment in the fight for real health care reform. We're also gathered at a moment of profound sadness for all Americans in the wake of Senator Ted Kennedy's passing last week. Almost 40 years ago, he introduced his first bill to provide health care for all Americans. This year, he introduced his last. So tonight, let us remember Senator Kennedy's powerful words about the need for real health care reform. Tonight we continue Senator Kennedy's lifelong mission. Our message to Congress is this. Millions of people, our family members, neighbors, co-workers, friends, and many of us are suffering from the current broken healthcare system. This debate is about real people, and we can't afford to wait any longer for health care with a real public health insurance option. I would like to introduce, it said I'm a Move On member from Richmond. Also Code Pink, also World Can't Wait, also after Downing Street, also Green Party. We need to wear every single hat. We need to get out there and join up and be heard. And now I'd like to introduce Andrea Miller, also a Move On member among other things, who's going to be handling things, introducing folks and help organizing the reading of crisis stories that we're going to share tonight. Thank you.
Thank you, Ray. My name is Andrea Miller. I was a congressional candidate in the year 2008 in the district just slightly to the south of here, the Virginia 4th District. And one of my critical issues, and one of the critical issues for the nation, is health care. So today we know we have a number of doctors that are in the audience that are going to want to share their vision and information about health care. We also know we have a number of people, patients, who have their own patient stories. In the event of health care is an issue that affects every living person. At some point in our life, we are going to have a health care need. And right now in America, the question really is, when you have a health care need, will health care be there for you? We already know for 47 million Americans, no, it isn't there, it isn't accessible. What many people don't know is there are many people who currently have some insurance, however, they are woefully uninsured. 62% of the bankruptcies that occur in the United States are, 62% of the bankruptcies that occur in the United States are because people are unable to pay their medical bills. Of those 62%, 80% of those people had health insurance. So having insurance and health care are not the same thing. So we're going to take a slightly different tack than some of the people do in some of these other meetings, because there are a number of us here who have made it a point of very carefully studying the policy and understanding the differences between single payer and the public option. So again, it's all health care, and we believe the public needs to be educated about what is coming down the pike in Washington. Now, Dr. Lurla Joseph, would you be willing to start us off? Lurla's going, why do I always go first? Well, I don't know, partially because you always look so good and you're standing right up there in the front of the line.
Good evening, everyone.
Hold the microphone up.
Oh, good evening, everyone.
There you go. Go up to your microphone.
Okay. I am Lurla Joseph. I practice general internal medicine. I've been practicing for 29 years. So I've seen a whole lot of things happen in healthcare. And one of the things that we are constantly told with this healthcare reform is that we're going to improve the cost outcomes. Well, when I started 29
only gotten worse. Our GDP for healthcare was about 10%, 9-10% about 29 years ago.